Hey, welcome back to Morning Joe. With us on the set, Republican Senator from Wyoming, Senator John Barrasso, and Democratic Senator from New Jersey, Senator Robert Menendez. Senators Barrasso and Menendez are both members of the Senate Foreign Relations Committee. And
good day to have you both in.
Senator, your chairman, both of your chairmen, said over the weekend that, quote, "we are not at war with Libya." Is that a message you take to the people in New Jersey? Because it looks like war to us.
Well, what we are doing is pursuing a UN humanitarian mission to make sure that innocents aren't slaughtered. Now, that involves military action. And to the extent you have military action, one might define it as war. But at the end of the day...
Do you define it as war?
Well,
are we at war with Libya?
I define it that we are actually in a military action to make sure that those who are seeking their freedom have the wherewithal to do so and not be slaughtered by Gaddafi at the end of the day.
So you support this mission?
Oh, yeah. I sponsored the Senate resolution, joined by my colleague from Illinois, the Republican senator from Illinois, together. And the Senate supported the resolution to say, let's call for a no-fly zone.
Senator, what do you say to your constituents in Wyoming who see the United States stretched in Afghanistan and in Iraq and now going in to Libya as well?
Yeah, with regard to Libya, we say, what's the goal? What is our role?
What is the goal?
Oh, good.
Because the New York Times says target is clear, intent is not. The Times has it right. What is our intention?
Well, the president has said different things. At one time, he said, that Gaddafi is not in a position. He has to go, can't rule. Although the president said we're not going to go and try to take him out. Admiral Mullen said the same thing. He said he didn't know exactly how it was going to end. Were they going to go after Gaddafi? Were they not? Who's in charge? Is this war by committee? And I think that's what the concerns are. And that's what the people of Wyoming want. And we have people, men and women from Wyoming, brave men and women in Iraq, in Afghanistan, in Kuwait, and will be involved in this as well if they're asked to serve.
Do you agree with the president that Gaddafi has to go?
Well, I certainly think that the guy who ultimately ordered the Pan Am 103 bombing, in which hundreds of Americans, including many from New Jersey, died, that someone who has mustard seed gas, and while we have tried to work during this period of time to reduce his weapons of mass destruction, is capable of using it. Someone who is using aerial bombing on citizens.
This is a yes, right?
Well, what I'm saying, Joe,
does he have to go?
Is that I don't think he wanted to stay. Do you want him to stay? I don't want him to stay. Now, the difference is how one effectuates that goal. In this case, it's about giving those who are fighting for their liberty the chance to affect their own future.
Well, what do you say to people in New Jersey and Wyoming when your constituents say to you at the next town hall meeting, hey, let's stop spending billions of dollars blowing up other countries and start rebuilding New Jersey or start rebuilding Wyoming? We're spending $2 billion a week in Afghanistan, an untold number in Iraq, and now I think we've already spent well over $100 million with missiles in Libya. When do we start spending that money in New Jersey?
Listen,
when do we start spending that money in Wyoming?
As someone who voted against the war in Iraq, I can tell you that I'm all for drawing down there. I'm also for changing our mission in Afghanistan. I'm also for taking $35 billion in tax benefits to the oil industry that is making record profits and returning it back to our own needs here in the United States.
Did you vote against tripling the number of troops in Afghanistan? Were you against the president's plan to triple the number of troops in Afghanistan?
I am of the view that instead of a counterinsurgency effort, we need a counterterrorism effort, and those are two different dynamics.
Exactly. Hey, Senator, let me ask you, and then Mika, I'll turn it over to you. Let me ask you, Senator, because I keep bringing up Wyoming, because I know Wyoming constituents think a lot. I've talked to them. They think a lot like Northwest Florida constituents when it comes to U.S. involvements overseas. At some point, they say enough. Let's focus on the United States and stop fighting wars across the globe. At what point do Wyoming residents get fed up spending all this money overseas?
But Wyoming people, we balance our budget every year. They're concerned that the president isn't leading in other areas, such as balancing the budget. I was one of 64 members of the Senate. I mean, that's enough to pass anything. 32 Republicans, 32 Democrats that said to the president, it's time to engage, Mr. President, on the budget, on the debt, on the what's coming up with the
What about the Pentagon budget? Do we need to cut the Pentagon budget?
There is waste all across this government. We're spending money we don't have. So much of it is borrowed from the Chinese. 41 cents of every dollar we spent last year was borrowed money.
Wow.
People of Wyoming do not like that at all.
Are you supportive of military action in Libya, and would you call it war?
It sure looks like that's what's happening. The president said no troops on the ground. We'll see what happens. I get concerned about any sort of mission creep. You know, where are we today? Where are we going to be? The president said this will be short. It hasn't been defined. The president has said, you know, this is going to be very short. So did the Secretary of Defense. Let's see. Lots of things are supposed to be short, and then they turn into weeks and months. And you know, you want to go in and say, what's next? How do you get out of here? And I haven't heard that answer yet from the president or from the secretary.
Well, it's interesting. Some of the strongest Republican voices, like Senator John McCain, have said that we waited too long and acted too weakly. Yeah. I mean, so, you know, you're damned if you do, damned if you don't. I'm sure that if we had allowed the continuous slaughter of innocents, we'd have many of our Republican colleagues saying the president should have acted. So we are acting here in concert with a series of other countries under a UN resolution. And so far, I'm glad to see for the first time that the French, for example, and the British are largely leading the way. And so I think we're doing the right thing.
By the way, the Arab League also stepping in last week. No, I think the president handled it very well up until this weekend. And like Barney Frank, I'm a little concerned about the fact that the United States may get pushed out in front again.
And also, is what you just said, given the fact that we have the support of the Arab League and the Gulf states, does that then discount the double standard that some may say exists when it has to do with Yemen and Bahrain? I mean, why aren't we?
I think the magnitude of what was happening in Libya was compelling. Now, I don't condone, actually I condemn what's happening in the other countries that you mentioned, but there is a difference in magnitude, at least at this point in time.
Okay, so you guys came on to talk about health care.
I didn't, but I'm happy to talk about it.
But the good doctor always wants to talk about
it. It is the 1-year anniversary.
I'm always glad that the good doctor cares about my health.
And you're here to support my tirade against junk food.
So a year later, how is healthcare reform going?
More unpopular than ever. More people oppose this healthcare law and want it repealed than they have for the last 10 months. As Nancy Pelosi said, first you have to pass it before you get to find out what's in it. As people are finding out what's in it, they don't like it.
But you do agree we need to reform healthcare. We spend more money than any other country.
We need people
less
want
efficient.
the care they need from the doctor that they want at a cost they can afford, and none of those things have come through.
I want to live forever. That's not
come through. We can't do that, though. Of a healthcare law.
We can't give everybody what they want, though.
The care they need, they actually need, the doctor they want, at a price they can afford, and the president's promises on all three of those have been broken.
What is the Republican plan to slow down the massive
cost? Is to focus on the cost. You got to focus on the cost. You got to make it legal for people. Well, one is let states opt out. Lindsey Graham and I have a bill called the State Health Care Choice Act. 2.5 million Americans, almost half of those union workers, have been given a waiver that they don't have to live under this health care law.
Is that going to save us money?
Well, getting states the rights to get in there and make decisions is going to save you money. Letting states decide which components to live under, which components to not live under is going to save money. Wyoming, we know, and I was in the state Senate there, worked on this issue there, we know that for Medicaid, we pay twice for the average person to get covered under Medicaid as we did if we just gave them a Blue Cross Blue Shield card. You could save half of the money right there.
Senator Menendez, you still love the law and you're proud of it, but it's not as popular. Senator Barrasso's statistics are right. It's not as popular as you think it should be based on what's in the law.
Its popularity is rising, number one. Number two.
Let me ask you, will it be more popular, substantially more popular by the time the president stands for re-election, and why isn't it more popular?
I think that if you have a pre-existing condition, you now know that the law is on your side and you can't be denied insurance anymore. If, in fact, you're a senior citizen and you had that gap in your coverage for prescription drugs, that gap is closing, and it makes a difference.
The law more popular?
I think the more people know about the law, they ultimately will love it. Look, my own governor is using millions of dollars as a result of the law to help him meet meet his challenges in New Jersey, as are governors throughout the country, both Democratic and Republican. So either you want the resources, changing the fact that you can't be denied pre-existing conditions, changing the fact that seniors now can afford their prescription drug coverage,
but
and everything else that flows, keeping your children on to age 25.
What changes the dynamic? Because it's been a year. You say eventually Americans are going to get it. How do you change the dynamic so
every
Americans
poll I've
get
seen,
next
Joe,
year that,
they say don't abolish it.
Right.
Because everything the doctor referenced before, that you want to have the health care you need with the doctor you want at something that's affordable, that didn't exist before the law passed. We had double-digit premium increases every year. Insurance companies arbitrarily and capriciously denying people coverage, even when they had the coverage and paying for it. So, in fact, we're moving in a different direction. And that direction, people, I think, will increasingly appreciate as they receive the benefits
well, let's
of the
ask
law.
a good doctor. You look at some polls, they say Americans don't support health care reform, but the same polls show that Americans don't want it overturned.
Well,
so
Americans are afraid that their costs are going to go up, even though the president said they'd go down. They're afraid they're going to lose the care that they have, even if they like it, and that even the White House statistics say that. We need something that is actually patient-centered, not government-centered, not insurance company-centered, something that people can rely on. And we're not getting that right now.
By the way, the senator engages in very unhealthy activity. The doctor, senator, he says he wakes up at 5:30, goes down to the Senate gym, and people are watching Willie Geist way too early. The morning show. That's awfully early.
Very early. You need your sleep.
I mean, why are you doing that if you don't have to? We have to wake up. Right?
Well, people in Wyoming are already up at that hour. They may call the office, and I want to talk to them.
All right. Good answer.
Thank you very much.
Thank you, Senator.
Barrasso, Senator Menendez, thanks
you.
very much for being on the show this morning.